Welcome. I'm Jasmine Iru with another episode of Scope. Mental health services coverage in Papua New Guinea is low. Mental disorders and its traumatic effects are increasing drastically in homes, schools, and communities with a growing population. This imbalance is not healthy for our young developing nation, where more than 50% of the country's population of 8.0 million are children.
The world has changed intensely as we experience the unprecedented chaos caused by stress and demands that have impacted the mental health of millions of people. And Papua New Guinea is no exception, facing its own challenges. Mental health conditions is a broad term that covers the range from mild psychosocial distress to mental disorders that may be temporary, chronic, shifting, or progressive. The increase in mental health problems and illness that persists today in our society places the country in a real dilemma, needing an immediate solution.
A mentally healthy workforce and society is vital for high work productivity in workplaces and schools. The increasing mental health problems and illness that persist today in our fragile society has placed the country in a real dilemma, needing an immediate solution. Our Directorate in Mental Health Policy supports the WHO Global Comprehensive Action Plan 2013 to 2030. The four major objectives are set for more effective leadership and governance, for mental health, the provision of comprehensive integrated mental health and social care services in community-based settings, implementation and strengthened information systems, evidence and research and implementation of strategies for promotion and prevention. The above action plan recognizes the essential role of achieving health for all people. It is based on a life course approach, aims to achieve equality through universal health coverage, and stressing the importance of prevention. The priority outcomes for the Directorate in its corporate plan are summarized as follows. Number one, effective and reliable mental health care services. Number two, increase accessibility to mental health care services. Number three, reducing mental and neurological disorder prevalence and incidence through advocacy and social interventions. And four, mental health care services, manpower and training requirements meet our present needs.
Common mental health conditions include difficulties with behavior, learning or socialization, worry, anxiety, unhappiness or loneliness, depression, substance use, intellectual disability, and autism. With enough evidence through clinical observations and mass media reports suggesting that the cause of mental disorders and traumatic effects have led to increasing suicide rates, cult activities in schools, violence, alcohol and drug abuse, rape, HIV/AIDS, domestic violence, poverty, and others. Seeing the need to address these, the Directorate of Social Change and Mental Health Services was proposed after a series of consultation meetings with mental health workers and stakeholders throughout Papua New Guinea. The Directorate was evoked through a ministerial task force initiated by the Ministry of Health in 2010.
The Directorate will see that the people living in PNG to be a nation of mentally healthy individuals, families, and communities where self-reliance prepares all for sound mental health in the healthy islands environment. We must accept the truth that mental and behavioral disorders are common in people during our lives. They are also universal in all countries and societies. They have an economic impact on societies and on the quality of individuals and families. Our government is proud to be in line on this matter with our homegrown Directorate. It is evident from the many activities set out by the Directorate for Social Change and Mental Health Services have been proactive with numerous initiated events in our nation. I take pleasure in congratulating the mental health workers for our nation and the PNG Psychiatric Association for leading this crusade.
It is evident from the many activities set out by the Directorate for Social Change and Mental Health Services have been proactive with numerous initiated events that needs the nation's support. On Wednesday, May 31st, the Health Ministry and the Directorate of Social Change and Mental Health Services launched 3 programs to be rolled out in the country to address mental health. Patron of the Mental Health Association, Dame Carol Kidu, spoke against stigma.
Let's get rid of the stigma. Mental health has a stigma to it, still in Papua New Guinea, and people and families that are dealing with mental health issues feel that stigma and shame. It's nothing to be ashamed of. And the second message that I wanted to put across today was that mental health affects everybody, not just those who are medically and clinically have mental health issues, but every single person. It affects me at different times. It affects my late husband. It affects all of us when we are unable to cope sometimes with the stresses. And now and today, with this really difficult times we're facing, with this intersection between tradition and modernity and rapid social change, and we're not being able to keep up with it, it also brings enormous stress into individuals, into families.
Dame Carol Kidu gave full support and the need for more collaboration on addressing mental health in the country. Acting Director of Social Change and Mental Health Services, Dr. Uma Ambi, has been a committed fighter against mental health.
But we also have a commitment to the proper service to the whole community, the minor mental health problems. How do we address? They don't come to Laloki and psychiatric unit. So that is important. How are we going to reach the people of Papua New Guinea to give them, so elevate poverty, make them proper, productive, being harmony? How do you get the Vision 2050? You can make him policy now, kind something. Now you by Hamama stop, but you must make him walk. Lo you yet. Lo make him something. Lo bring him word of God. Now passing lo Papa God. Lo one him religion doesn't matter, like Dame Carol said. We have to do that. So we have a comprehensive. So good plus something.
The Directorate will be entrusted to monitor the mental health well-being of people in the communities and to promote and encourage the maintenance of community mental health care at an acceptable level by planning and delivering good mental health practices with related mental health services, as it works to achieving the PNG Vision 2050 that states, "Our intention is to transform our people and our nation by reforming our mindset and attitudes. It will provide the direction to reform and align our institutions and systems to make Papua New Guinea become a smart, wise, fair, healthy, and happy society by 2050.
After the break, Madang to trial integrated criminal case system database. The Integrated Criminal Case System database is an offspring of the National Judiciary Staff Services in its infancy stages. It is set to roll out a pilot project in the Madang Province. This initiative came about through lengthy and rigorous discussions, trainings, and workshops with law and justice sector agencies, including the Royal PNG Constabulary, the Correctional Services, and stakeholders.
The Integrated Criminal Case System database is a realization of the National Criminal Process Improvement Project 2013 of the Government of PNG to embark on an innovative approach to improving law and justice agencies under the guidance of the National Coordination Mechanism. The National Coordination Mechanism developed the Sector Strategic Framework, which sets out the sector's vision of a just, safe and secure society for all. The SSF identifies 5 goals, including improving policing, safety and crime prevention, improved access to justice and just results, and improved accountability and reduced corruption. When the NCPIP Working Committee was formed, it embarked on compiling a discussion paper to table to the Chief Justice on issues affecting their operation, mainly on criminal case management track. The paper comprised of strategic advices based upon their findings into the coordination and work of various law and justice sector agencies involved in the various phases of the criminal case track, from arrest to trial and appeal, and on the emphasis of reviewing the present criminal case management track at every important stage to cut down on the delay in case disposition. The discussion paper was tabled in October 2013 following a Memorandum of Understanding signed in 2015 and later re-signed in 2020, which sets out an agreement between law and justice sector agencies involved in the criminal case management. One of the key recommendations of the MOU was to develop a sector-wide database for the criminal justice sector. This criminal database is the ICCSD. In an instance when a crime is committed and arrest done, police will have to register this in the ICCSD. From there, information of offender and details are entered and uploaded for the next agency to act on. This will be the judiciary. They will enter all vital information regarding the trial and sentencing of the offender. Then it moves on to the Correctional Services, who will then enter details of the sentencing, paroling, and other information. The system would ensure the information and the officers involved in each case follow a synchronized and more efficient process in ensuring data management, transparency, and accountability from start to finish. A vital partnership has been struck with the New South Wales Judiciary Commission and the studies, workshops, and dialogues initiated to roll out this database. After many trials, challenges, and setbacks, Madang Province has now been chosen to pilot the project. A workshop on the ICCSD was done for all law and justice sector agency officers in Madang recently. It was an intensive week of information upload and processing for the participants in order to understand the system itself and the requirements needed to ensure that it works and that it can be rolled out in all other provinces. The workshop concluded with a certificate presentation to participants to commence implementation. Chairman for NCPIP and resident judge for Madang, Justice Yova Gaeta, stated that he would back this project by ensuring that funding is pumped into it so it continues.
So on our part, we are going to make sure that we continue to fight for funding from our government. I have told Mr. Kwara and the registrar, if it means I walk personally into the Prime Minister's office and demand that this project that we are doing is not something for the courts, it's a nationwide project and it's far-reaching, affects the rest of the country. You put money where your mouth is. So I've told them, if there are problems, you let me know and I'll march to the Prime Minister's office and demand them. And so I will do that.
Jomba Police Station Commander Inspector Patrick Wallace recognizes the task at hand for police in initiating the process by ensuring that accurate data is entered for all other agencies to access and progress with. He also acknowledged the fact that as a manager, he can measure staff performance by how well they utilize the system from the system indicators.
For me as a station manager, I can also be helped in such a way that I see my policemen and women performing, or are they really working or they're not individually. This is where it is also helping me with this data thing that we have already set at this station, but in this province, I should say.
Clerk of Madang District Court, Paul Kig, participated in the workshop. He was happy to have gone through this ICCSD training and learning how to implement this project. Mr. Keeg hopes that within a month's time, when they all have grasped how to go about entering and managing the data in each sector agency's performing requirements, they should be able to get it running. The Office of the Governor has also indicated support to the project by pledging funding. This is a sign of relief for the judiciary.
And I flagged it to the Governor for funding opportunities. And he gave me a response. He said, we are behind it and we are going to look for funding. Currently, for this year, budget has already been passed, but his commitment is we will look for funding. He is a lawyer by profession and he is behind and supporting this program. So Madang, you have a leader who's behind you. We have to make this work to show that other provinces, when we make this work, it rolls out in other provinces and we have the opportunity to do that. And as we've been hearing throughout the week, we participate to a bigger outcome. We have heard from the PNG. So look forward to that as you continue your work. We are contributing to a bigger picture. And in my encouragement to conclude, reach out to one another. Training is one thing, implementation is something else. When you get caught up with your daily activities, your routine tasks, these things may slip out of your mind and you get caught. And then you come back and you want to enter and you say, how do I go about it? Look around you. These are the people you reach out to when you are stuck. All in all, we are the team that will make it work for the change that we want to see for Madang and for PNG.
This week, each participating agency in Madang will get one-on-one training before facilitators return to Port Moresby.
When we come back, inclusive green finance policy, a pathway to greener economy. The Inclusive Green Finance Policy has been launched. The policy is seen as a pathway to greener economy and for a resilient future. Prime Minister James Marape, who launched the policy, said the Inclusive Green Finance Policy serves as a reminder for all of us to conduct our businesses in an environmentally conscious manner. He said by offsetting our global and PNG carbon footprints and participating in the conservation of PNG's tropical rainforest and mangroves, we can mitigate the impacts of climate change.
The Inclusive Green Finance Policy was launched during a ceremony at the Hilton Hotel in Port Moresby. It was presided over by Prime Minister James Marape, who expressed his honor in inaugurating this significant policy.
Of the Bank of PNG.
The Prime Minister encouraged government departments, state-owned enterprises, financial institutions, and MSMEs to collaborate and utilize this policy as a foundation for building a green business economy.
I want to commend the bank and I look forward to partnership. I look forward to the work of delivering to the intention of this policy. Our government stands with the bank ready to assist where we can.
Mr. Marape emphasized the policy's importance in addressing climate change and how it will benefit the people of Papua New Guinea. He stressed the need to develop the country's economy in a smarter and climate-resilient manner, fostering low-carbon, inclusive green growth.
The unpredictable weather patterns, if it does affect business, if it does affect society, then our central bank can look at these resources mobilized to assist businesses and assist communities in our country live through the perversities or adverse effect of unpredictable climate change and weather patterns amidst us going forward.
The Prime Minister expressed gratitude to the Bank of Papua New Guinea, the Global Green Growth Institution, the New Zealand High Commission, financial institutions, and other technical and development partners for their collaboration in designing and developing the Inclusive Green Finance Policy.
Thank you very much for the Bank of PNG for localizing this issue and bringing it into the forefront as one of your key work work policies. Thank you very much.
The Prime Minister commended the Green Taxonomy, a unique feature of this policy, which is the first of its kind in the Pacific and Papua New Guinea.
It does not make us be complacent. Rather, we must continue leading in as far as being responsible to the environment that we are stewards of. And so being responsible to the environment calls for all businesses and all human activities to be cognizant on how your activity impacts on the environment.
Elizabeth Genia, acting governor of the Bank of Papua New Guinea, underscored the significance of embracing green finance and adopting a proactive approach to address environmental risks and invest in projects that promote long-term sustainability. The acting governor emphasized the responsibility of financial institutions to integrate environmental and social factors into their investment decision-making processes. She encouraged the development of innovative financial products such as green bonds and sustainability-linked loans to facilitate green investments.
This potential will receive specific encouragement. Bank of Papua New Guinea and its strategic partners plan a Green Finance Centre at the SEFI office. The centre will offer support activities including training, technical assistance and design of innovative green lending products.
George Awap, Assistant Governor of the Financial System Stability Group at the Bank of PNG and Chairman of the Inclusive Green Finance Steering Committee, highlighted the policy's development and the discussion surrounding the impact of climate change on economics. Mr. Awap provided a brief overview of the journey toward implementing the inclusive green finance policy in Papua New Guinea. He further explained that a steering committee chaired by the Bank of PNG worked collaboratively to develop the inclusive green finance taxonomy policy. The launch of the inclusive green finance policy marks a significant milestone for Papua New Guinea, demonstrating its commitment to building a sustainable and environmentally friendly economy and fulfilling the international commitments to the Alliance for Financial Inclusion under El Sheikh Accord. Through collective efforts, the government and financial institutions aim to steer the country towards a low-carbon, inclusive green growth pathway and address the challenges posed by climate change.
And that's another edition of Scope. Thank you for your company. Good night.